Hey everyone, my name is Taylor Avon and I am doing my critical assignment for the disease state presentation on the measles for my class of pathophysiology for public health. The current disease state that I would like to address that is affecting the public health in America is the measles. If one was to look at recent news articles, they would see that in the past year or two there has been a measles outbreak or epidemic. According to our textbook, Gould's Pathophysiology for the Health Professions, the author states that an epidemic occurs when there are a higher than expected number of cases of an infectious disease within a given area. Many people believe that the rapid spread of this highly infectious disease is in high part due to anti-vaxxers, also known as parents who are against vaccinations, which prevent their children from receiving potentially life-saving vaccinations against deadly diseases. Due to the rise of the anti-vaccination movement, measles cases have risen to over 800 in the United States, while it was at one time almost completely diminished. Education and vaccinations are important to reduce the spread of contagious deadly diseases such as the measles. Measles, also known as rubella disease, is highly contagious and is making a comeback in cities across America. It was first recorded and written about in the 9th century by a Persian doctor. In 1757, a Scottish physician wrote about how this highly contagious disease is caused by an infection in the person's blood. By the year 1912, it was required for the healthcare providers to report cases of the disease, with nearly 6,000 measles-related deaths being reported each year. According to the CDC, in the decade before 1963, when a vaccine became available, nearly all children got measles by the time they were 15. It is estimated 3 to 4 million people in the United States were infected each year. Also, each year, among reported cases, an estimated 400 to 500 people died, 48,000 were hospitalized, and 1,000 suffered encephalitis, which is swelling of the brain from measles. To prevent this significant number of infections and death is why the development of the measles vaccine was so important. According to an article that was published in Medscape, some of the pathophysiology traits of the measles includes temperature. The infection is likely to thrive during late winter and early spring, which may contribute to why it has currently spread so rapidly in the United States. The Medscape article states infection is transmitted via respiratory droplets, which can remain active and contagious either airborne or on surfaces for up to 2 hours. Dr. Selena Chen also states that the virus can enter the lymph nodes, which causes it to spread to various other organs. Measles weakens the immune system and can cause a patient to be more susceptible to bronchopneumonia or pneumonia, which is a major cause of measles-related deaths in children. Infants who are too young to receive the vaccine are in the most danger of contracting and/or dying from the infection. The picture on the right shows how the spread of measles versus Ebola works. They are both transmitted by airborne droplets, but the measles droplets are lighter, therefore they can travel further. In order to try to eliminate a disease, we must first learn what causes the disease to manifest in the first place. One of the ways this was accomplished is through a study in Poland, which was when the research team studied which viruses may cause measles-like illnesses. Besides the measles virus, they tested patients exhibiting a high fever and/or rash that had been present for more than 5 days. They found many measles-like illnesses were caused by pathogens other than the measles. The measles is a viral disease caused by an infection of the rubella virus. It is an airborne disease where tiny infected droplets may spread through coughing, talking, or sneezing. The highly contagious virus can remain active while sitting on a surface for several hours. The graph here shows how dramatically cases of the measles has decreased in the United States since the vaccine was licensed. The onset of measles ranges from 7 to 14 days after initial exposure to the virus. The signs and symptoms of the virus include a high fever, dry cough, runny nose, sore throat, conjunctivitis, which is inflamed eyes, Koplik spots, which are small bluish white spots that can be found on the inside of the cheeks, rashes, fatigue, and loss of appetite. There is no cure for the measles. Vulnerable people who have been exposed may receive a post-exposure vaccination or an immune serum globulin. Other medications that may be used will be fever reducers, vitamin A, and/or antibiotics. The picture here shows how the rash usually first appears on the face and neck and quickly spreads to the rest of the body. By spreading awareness of these signs and symptoms of the measles, it can remind parents of how deadly the disease can be, especially for younger children. Spreading awareness would also inform the public and possibly cause vaccination rates to rise. The first recommended dose of the vaccination for measles, mumps, rubella is between the ages of 12 months and 15 months. The second dose is recommended between 4 and 6 years old. With the current measles outbreak affecting the United States and other countries as well, it is important for healthcare providers to screen those exhibiting common symptoms of the measles, also known as rubella. The picture to the right shows the states that have had cases so far in 2019. Some outbreaks have been linked to tourist attractions such as Disneyland. The California Department of Public Health website provides weekly reports on the total reported measles cases in California. One current screening tool that is utilized by the Arizona Department of Public Health is their Measles Surveillance Toolkit for healthcare settings. This is a guide that provides information such as a description of the disease, recommended vaccination for healthcare personnel, prevention and control in a healthcare setting, tracking forms, screening tools for emergency departments, and general measles notification letter examples. The manual explains some of the prevention measures that should be taken in the case of the measles outbreak in a medical setting and are to review the immunity of measles in all exposed staff, check vaccination records of those without immunity, isolate those with the active illness, and provide a first dose vaccination for personnel without presumptive evidence of immunity, and having them stay home for 5 to 21 days, isolating patients who are suspected of having contracted the virus in a negative pressure room, as well as taking airborne and respiratory precautions. In regards to prevention, some improved efforts can be made. According to a journal that was published by the American Academy of Pediatrics, the reason why 31 preschool-aged children went unvaccinated was investigated. It was discovered that in some cases, healthcare providers missed the opportunity to vaccinate those who were eligible to receive the measles, mumps, rubella vaccination. Some were also provided with other vaccinations, such as diphtheria and tetanus toxoids, while the children could have also received the measles vaccination at the same time. In 1954, two men named John F. Enders and Dr. Thomas C. Peebles were successful in isolating the measles virus in a student's blood during an outbreak in Boston, Massachusetts, which led to the creation of the measles vaccine. An improved version of the vaccine was introduced and distributed in 1968 and is often used as a combination with the measles, mumps, and rubella vaccine. Since the vaccinations have been used, it has almost completely eliminated the measles disease as of the year 2000 in America. This is why vaccinations are so important. They help to reduce the widespread infections and deaths from these diseases that have wreaked havoc in the past years. If we can prevent this from happening again, why resist it? According to publications by the CDC, CNN, Business Insider, etc., this is the worst outbreak of the measles disease in the U.S. since it was declared virtually eliminated in the year 2000. More than 800 cases have been recorded in the U.S. this year alone. Cases have been reported in as many as 23 states in recent months, including my home state of California. Once a case is detected, the patient will be quarantined and monitored to prevent the spread of the infection. A quarantine was issued in the past month for two major LA universities, the University of California and Los Angeles of California State University. Once the cases were discovered, health officials and the universities acted quickly. Those students and university employees, numbering more than 200 people, were ordered to stay home, avoid contact with others, and notify public health officials if they developed symptoms. Notices were sent out letting people know when and where those who were affected had been in the previous days in case they had contact. Although maybe not everyone who was quarantined may have had contact, I think the schools acted quickly and efficiently to avoid the spread of the disease. As the old saying goes, it is better to be safe than sorry. This concludes my presentation, and thank you so much for listening. I hope you enjoyed.